COVID-19.
Kami berkorban jiwa dan kami berkorban masa untuk family kami, semata-mata untuk korang. Tolong kami. Kita jaga kita. Duduk di rumah.
Assalamualaikum Doktor. In this video, we will present about the current issues related to human resource management, which is burnout issue among employees during COVID-19. Before we start, let me introduce my group members. My name is Aina Balqis binti Muhammad Zain.
My name is LIYANA ADRIANA binti FARID.
My name is Aina KHAIRIYYAH binti DAUD.
My name is ATIQAH SYAHIRAH binti DAHARI.
My name is NADIRAH binti ZAIDI. Firstly, I'm going to start the presentation with factors lead to burnout among employees at workplace. Before that, according to the World Health Organization, burnout is a phenomenon that results from unmanaged prolonged workplace stress. There are various reasons that might lead to burnout among employees during the pandemic. First, the increased amount of workload is linked to burnout issues. According to Health Director General Nur Hisham Abdullah, ICU occupancy rates in Kuala Lumpur, Selangor, Penang, Sarawak, Kedah and Perak exceed 80% in May 2021 to treat COVID-19 patients. That causes healthcare employees in Malaysia to suffer from burnout as the impact of experiencing higher workloads during a pandemic because of the unbating number of COVID-19 cases that require hospitalization and intensive care. Other than that, burnout is one of the common issues that arise from long working hours. According to the local study, the healthcare employees who work more than 60 hours per week were shown to have higher burnout scores. This is because long hours are associated with prolonged contact, prolonged wearing of PPE and sleep deprivation, and this is may emphasize burnout development. Therefore, working extra long hours may lead to burnout, which will affect health both psychologically and physically. Lastly, according to the World Health Organization, uncertainty is inevitable. This is because uncertainty about the future impairs one's ability to deal with unfavorable occurrences when it occurs. For instance, the contract doctor system offers little to no job security and limited career progression. Furthermore, reports in 2020 show that close to 4,000 contract doctors were expected to expire by May 2022, leaving their futures uncertain. Moreover, in July 2021, it was reported that 163 contract doctors had resigned since January in Selangor. Although there were several reasons behind their resignation, pressure and emotional burnout were cited as predominant concerns. This is because contract doctors suffer several inequalities compared with permanent colleagues, when in fact both parties do the same work.
Next, I'm Aina KHAIRIYYAH and I will explain the effect of burnout among employees during COVID-19. As we all know, burnout does not develop overnight. At first, the signs and symptoms can be mild. However, the longer they are ignored, the worse they will become, potentially leading to a breakdown. There are several effects of burnout among employees during COVID-19, which are low employee satisfaction and employees feeling extremely fatigued and discouraged. Firstly, burnout causes employees to experience low job satisfaction. Job satisfaction is related to how people think, feel and perceive their jobs or employment status. Employees who enjoy their work and attain satisfaction from doing their job tend to experience less emotional burnout. However, when employees experience high emotional burnout, they will experience low job satisfaction as they have no enthusiasm and have negative feelings towards their job. they may lack the motivation to achieve optimum performance and excel in their positions if their expectations are not satisfied. For this reason, employee low job satisfaction and unhappiness in the workplace should not be underestimated by the top-level management, as it would hinder the company from gaining more profits. Secondly, burnout causes employees to feel extremely fatigued and discouraged. Employees will be emotionally drained and unable to deal with challenges at work and in their personal lives. If left untreated, burnout can make them depressed, anxious, and distracted, affecting not only their work relationship but also their personal interactions. Based on one study that was conducted in October 2020 by the British Medical Association, found that around 59% of doctors reported higher than normal level of occupational exhaustion and fatigue during the pandemic. Furthermore, according to Health Director General Tan Sri Dr. Nur Hisham Abdullah, the current pandemic has caused physical and mental exhaustion among frontline employees, which has affected their concentration and productivity in providing community services. Hence, the effect of burnout from extreme exhaustion can affect their work performance as well.
I'm LIYANA and I'm going to discuss the data about burnout issues among employees. A cross-sectional study was carried out among emergency healthcare employees at a huge teaching hospital that was designated as a COVID-19 treatment center. As we all know, job workload and responsibility have increased significantly since the implementation of the Movement Control Order. Therefore, a survey made of 28 questions and graded based on a 5-point Likert type scale was distributed from 8 May 2020 until 15 May 2020 among emergency healthcare employees. The results of the questions were then added together to determine the frequency of burnout among emergency healthcare employees in the hospital, as well as the factors that contributed to the burnout. Based on the figure 1, we can see that out of 51.3% of the healthcare employees working in the emergency medicine department (ED) has experienced burnout. It can also explain that the highest rate of burnout is nurses with a percentage of 61.2% compared to doctors with only 35.1%. To be concluded, we can say that nurses had the highest rate of burnout in the emergency medicine department (ED). Besides, feeling tired, fatigue, as well as suffering from frequent illness are parts of their burnout signs. During this pandemic, exposure to an angry public, job overload, lack of clear guidelines, and perception of being underpaid were the factors contributing to burnout in the workplace. Therefore, further research suggests that an intervention must be used to lessen the burnout among healthcare employees in order to avoid any negative consequences on their mental health, patients' care, as well as the institution.
Move on to the next part. I'm ATIQAH SYAHIRAH and I'm in charge to explain existing solution to the issue. The COVID-19 pandemic has put a huge strain on the healthcare system and its employees who are struggling to treat and contain this ferocious disease on the front line, and that has led to burnout issue. However, there are few existing solutions to the issue. Firstly, the Health Director General Tan Sri Dr. Nur Hisham Abdullah has announced that those involved in combating the COVID-19 pandemic will be granted unrecorded leave with the approval of the respective heads of departments. In addition, he also mentioned that healthcare employees will be given mental health cards after they finish their duties for the day. The main objective of this solution is for healthcare employees to be able to self-monitor their mental health because prevention is better than cure. Furthermore, Bath and Body Works also took part and gave vouchers to healthcare employees as an appreciation for their hard work. Lastly, Banyan Tree Kuala Lumpur also gave 40% off to healthcare employees for their staycation as an alternative for them to release their tension. Besides, I'm going to explain about recommendations to tackle the issue. First and foremost, the superior must conduct one-on-one counseling where the employees will open up the issues that they are currently facing. This method will help to break down the barriers that interfere with emotional and mental well-being. On top of that, hiring additional employees is also a good decision as it will help to reduce the workload of the existing employees. Hence, in the presence of additional employees, existing employees will be able to focus more on doing their duties without having to think about another workload. Lastly, burnout issue among employees can be cured by acknowledging their hard work during the pandemic. For instance, the superiors give a bonus to the employees as a reward for the effort and performance they gave. As a result, the employees feel appreciated and valued, which are all required for satisfaction at work.
I'm Aina Balqis. We present our analyzation of the recommendation to tackle the burnout issue. The first benefit of conducting one-on-one counseling is it helps employees to make better decisions about choosing benefits that are fitting their lifestyle, medical health, family, and budget. Added to that, it also helps the employee to combat stress, workplace depression, and declining productivity in an office. And simultaneously, they get to share their feelings and open up with higher level management regarding the issues they are facing. However, the disadvantages in which some of the employees might not be able to accept the comments they received, and employees did not believe their employers would fix the problem due to a lack of trust in one another. Moreover, hiring additional staff may bring several advantages, such as a short-term project will be done in a defined period. Next, employers are able to acquire more efficient employees instead of keeping non-efficient employees who bring consequences to the work environment. Nevertheless, some disadvantages may occur, such as the high salary increment expected by the high-performing employees, costly, and time-consuming job training for new employees. Lastly, the benefits of acknowledging employees' hard work are that employees will have higher levels of productivity, increased employee participation, and happier employees that will affect their job satisfaction, communication satisfaction, and organizational commitment. However, this process is time-consuming. Besides, it will create biases among human resource managers. Furthermore, excessive acknowledgement by the human manager would raise the tension among employees, which will lead to burnout, as they are obligated to serve high-quality performance. The best recommendation to solve the burnout issue among employees by doing one-on-one counseling between employee and superior. This is due to the fact that this strategy has more benefits than drawbacks. Many simple issues can be handled with short-term counseling. However, chronic or more complex issues require long-term counseling before change can be accomplished. Hence, one-on-one counseling is the most effective way in handling employees with burnout issue because prevention is better than cure.
That's all from us. Thank you.